Hello, I'm Dr. James H. Shrinker. I'm Medical Director of Integrated Health Concepts. Welcome to our website and welcome to our clinic. Integrated Health Concepts started as an idea almost 10 years ago. I was in a traditional practice, and what I noticed is the only people that seem to get better are the people that took charge of their lives and changed their life from the ground up. I noticed that traditional medicine and conventional medicine doesn't embrace that. They make a diagnosis. That diagnosis has a singular problem. That singular problem is then treated with a medication. The medications rarely work, the people get frustrated, they come in with more complaints from that medication, and soon become over-medicated and undertreated. So what we've decided at Integrated Health Concepts is there must be a better way. We have integrated alternative and holistic practices with conventional medicine. So when you come in, you'll see me, traditionally trained medical physician. We'll order the blood test and any test necessary in order to help us with the diagnosis. And that's about the end of the similarities between us and conventional medicine. Once we establish a diagnosis, we're going to use holistic and alternative approaches to come up with the least invasive, most natural approach for your problem. If that doesn't work, we'll become progressively more synthetic and more interventional. We'll do whatever it takes to get you better, but we're going to try to do that from a natural standpoint first. Our team approach is a comprehensive approach, but it's an approach from an alternative or holistic standpoint. Integrated health is a loaded term, and what you'll see today in conventional medicine is it seems to be a nice buzzword, and it integrates cardiology with pulmonology, in with family medicine or internal medicine. Our integrated approach approaches dietetics, certified diabetic educators, Reiki, hypnotherapy, acupuncture. We integrate all of the alternative therapies that we have in the building to try to formulate a personalized plan for you. Our individualized plan begins with me. You'll interview with me, and we spend as much time as we need to try to determine where we need to be. From there, we'll both make a decision on what's best for you. You're in charge, not me. You know what's best, you know what has worked, and you know what won't work. So what is holistic care? Holistic care to me is you're more than a physical person sitting in a chair in front of me. There's a spiritual component, an emotional component, and a biochemical component. What I can bring to the table is balancing of that biochemical component. With complete thyroid panels, with hormone panels, with vitamin panels, we can determine what your biochemistry is doing. We can bring that biochemistry into balance, which will help you heal spiritually and emotionally. It's hard to be your highest spiritual self when your body hurts and your body aches. Simply saying you don't feel well may drive your traditional doctor up the wall, but to us it's a red flag that something's wrong. It doesn't have to be biochemical, but we're going to check that out and make sure it's not. And if it isn't biochemical, there's a spiritual component or emotional component that we can help you with. Together, if we balance all three of those, that is complete well-being, and that is holistic care at Integrated Health Concepts.